I didn't know if you were AFK. That's why I was gonna move you right now. I see you.
Yeah, I thought he was still setting up his arsenal, so.
Yeah, that's why I didn't want to move you.
I still don't know how to get that armbands, but I'm good to go now.
I'm a
Oh
medic, but
my
I did not
dad.
know we were doing medic training, so I did not
Hey,
grab the
Grinch,
flag.
whenever you can, just take DMs.
Yeah, bro, I know. We're just doing a train, so I get to.
We'll go over what medics should be carrying.
Is the
and then
BMP
what
not
just
in here?
regular troops should be carrying. For right
BMP. I thought it was.
for right now, any rifleman, I want to set a standard for
Oh, maybe
medical,
BTR is my bad, not BMP.
so we know how much we're gonna need, what we have, and everything. So I want to first of all, I want to make sure everybody at least has 7 bandages, just because bandages are crucial, and you know, frag grenades or explosions or anything. I mean, you could have multiple wounds at once, and the more bandages, the better. I mean, you don't need to carry as much as a medic, so, but 7's good. I want to ensure everybody carries enough salines for one person. So we'll say 3 salines per rifleman, because if say someone's class 4 hemorrhage, you will need at least 4 salines, 3 salines to get them back down to class 1. Anything below, it's gonna take a lot longer to get them to class 1. And it's always good to just have. Please no shooting. Another thing, I want to make sure everybody keeps tourniquets on them. I know tourniquets, a lot of people probably don't use them, and it's something I want to push people to use. Is these tourniquets? Is if we're in a firefight and we need to drag someone back and get someone out of safety, and they have bleeding to their legs, arms, or something, a tourniquet only takes a second and a half or less to put on compared to a bandage, which is more than 8 seconds. So you can tourniquet them, hold them back, bandage them, remove that tourniquet, and then continue on with the medical processing that you need to do for them. Other things, I want to make sure everybody has an oxygen mask, as well as a chest seal NCD kit and a King LT, just to ensure, you know, we can provide oxygen back into the patient. Also, if they have a tension pneumothorax, we're able to help with that collapsed lung. Pneumothorax, we're able to seal that chest wound, and then for the King LT, we're able to open up the airway so they can breathe. So I'd say at least 2 is good, yeah, because it's not. Yeah, I mean, it's not often you're going to see a pneumothorax. So when you see that, when we go into the check injuries, which should be the first thing we do when we come up to a casualty, always check injuries first, because it's going to tell you what they're going to need in terms of if it's heavy bleeding, light bleeding, medium bleeding. Heavy bleeding, obviously, it's going to tell you, all right, they're bleeding from multiple different places, or they got one really bad wound that they're bleeding heavily from. Heavy bleeding usually will result in a class 3 off the rip due to a lot of blood loss. And when it comes to the blood loss, class 1 means you've lost only less than 30% of your blood. Class 2, you've lost 30% flat. Class 3, you've lost 60% of your blood. Class 4, you've lost 80%. And then 100% is fatal. That means you're full dead. So when you see class 4, you gotta take into mind that it's gonna take a minute for them to get up. Alright, so want to go into
Can you repeat that?
okay, yeah. So class 1, that means the casualty has lost less than 30% of their blood. Class 2 hemorrhage is they lost 30% flat, so 30% on like exactly they've lost. Class 3, they've lost 60%. In class 4, they've lost 80% of their blood. So
Thank
the higher the class, the percentage goes up more. I want to go into the medications real quick, because I know some people would use some for certain things and shouldn't. So first things first, we'll go into epi. So epi should only be used anytime before CPR or with a low heart rate. Epi will increase your chances of resuscitation, increase heart rate, and increase pulse. Mind you, when you put epi in someone, you only have 23 seconds for it to work, otherwise it's not going to do anything. So it only has a duration of 23 seconds, and that's it. And then we got metoprolol. Metoprolol is only used to reduce a heart rate or help bring down the blood pressure on a patient. So if you see a heart rate that's too high, get it up
What's
there.
too high?
Too high will be anything, I'd say 220 and above. Even then, we'll go into the BP. The main thing I would look up for is the BP, because the BP is going to tell you more. So anything, I say above 260, 240 BP, I would use more metoprolol. Because that's going to bring the heart rate down, bring the blood pressure down, which means you'll be able to get them up faster. First number, 130 over, well, so resting is 120 over, yes. Yes. But usually if it's, say, over, like, I'd say roughly 100, 120, it's not as bad. They're still able to get them up. Once you get up to a lot higher end, then it's when you want to start looking at it critically. Next medicine I want to go into, morphine. Morphine should only be used when a patient or somebody is in pain. So when you have the flashing on your screen is the only time morphine should be used. Morphine will reduce pain, it will lower heart rate, as well as the duration of morphine is just under 2 minutes at 1:57. So you can take 2, max, maybe 3, depending on how badly injured you are, of morphine. Anything more within that few minutes that you've injected yourself can cause an overdose. So I would say max 1 to 2 is what I would say. And once that 2 minutes is up from the point that you inject yourself is when you'll be okay to give yourself another morphine. Naloxone, you guys really don't have to worry about naloxone. I mean, it's not often you'll see an overdose. Occasionally you will, but naloxone is only treated for overdoses. Someone injects someone with more than 3 morphines, then it's going to be needed, but it's not often. Phenylephrine, this one's a big one. This one is going to reduce bleeding. So if somebody is bleeding out and you're dragging them to get them to safety, and they have heavy bleeding, and you're not able to bandage them right in the spot that they went down, inject them with phenylephrine. That's going to reduce their bleeds, so they're not going to bleed out as fast. So then you can then get your bandages, get everything on them to help reduce that bleeding. It will lower their heart rate, so keep that in mind.
Could that be considered a combat stim? Could I pop that before I go into combat and we'll stop my bleeds?
No, because the duration of effect is only 30 seconds. So it really
Copy.
won't do anything there. So I would say only use it when you're trying to
Use
move.
it to save a life, not trying to be self.
Exactly.
Something
So
like-
yeah, use it mainly when you're trying to move someone into a safer spot. If you do need to raise someone's blood pressure, then you can, but it's not often that you'll need to. Because I mean, if you're using it to slow down a bleeding and then you get the epi in them, and by the time you start compressions, you should have a couple of seconds. That's going to give you a little jump start on getting their blood pressure up when they're doing CPR. And then saline, I mean, saline's pretty straightforward. It just increases blood volume. So that's going to increase your class 4, so that blood volume from, 80% loss, so that 20% blood volume they have, it's going to increase that. Salines, they only last a minute and a half. So every minute and a half, you're going to have to put a new one on. Who the fuck is shooting into my training area? But now I actually want to go into hands-on training, so I'm going to get 2 guys per man out here. I believe I should. Yeah, I should have enough for 2 guys per man. I'm going to, let's take, who's this, Ghoul? Spooky, right? Is this Spooky? Spooky, you there? Alright, Ghoul and Spooky, go to the first guy on the left. Trippin and Curly go to the second guy. Neptune and Mr. Crisp go to the third guy. Let me get Trippy. Trying to see your name. Trippy and Yankee to the fourth guy. And then Flacco and Clempy to the fifth guy.
Is that Clumpy?
I don't have chest
Alright,
seals. Hopefully you do.
I'm going to give each one of y'all individual injuries to your character, and then I'm going to have you get them up and treat them whilst I listen to
First
the
order of
operations at
things,
which you go about this.
I'm gonna check the injuries on him. Once I do, I want you to just buy the. Oh shit! I'm hit! I'm hit!
He's
not
running. Stress over here. Alright, let's inspect.
My boy got shot over here.
Just class 1 hemorrhage,
What?
moderate bleeding.
What? There's no way I overpenned.
Oh shit! Real life.
Yep.
There's your fucking project.
Can somebody shoot Charlie Baker?
His chest. He's like moderate though.
Who's this over here?
He's good.
Yo. Who's this?
He killed one of our friends, ma'am.
Good. There he is.
Alrighty.
Thomas Meyer.
Alright, let me start. Let me get this guy real quick. So yeah, I mean, he was class 1. That wasn't too bad. You're able to get him up a lot quicker. Class 1, as you saw, is pretty quick to getting up. This one I'm going to make a little bit worse.
I'm hit!
Yeah, he might have missed that.
Yeah, alright. He can't take 2 shots to the chest. Confirm.
He's dead. He's dead. I can confirm he's dead.
Yeah, I don't think we need a
proactive
corner
watch
for this
this.
guy.
Yep. And if it's severe bleeding, we're just gonna add a tourniquet character and an alpha and get the bandage, boom, 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 and then add morphine with that. And then, yeah, saline, and there we go.
Has anyone got any spare medical stuff? I found my loadout earlier.
Why are you
medical stuff in the crates?
There's an arsenal over there.
Oh yeah, thank you.
Near the street light, yeah.
Alright, don't. Wait.
Is this supposed to happen?
Can we just shoot our own guys so we can start?
Yeah, I'm trying to inflict certain injuries to implement the new medical, so it's kind of. It was working for me earlier, now it's being an absolute fucking pain in the ass.
You want me to blast him with this 240?
Okay, Luke Brown, but you'll be safe.
Shoot him with the pistol.
You can get injured through the menu? What the fuck?
I got a switch on my pistol, man.
So why? Look at that.
Hmm?
Ooh.
Big
You know what's
switch.
crazy?
Again?
Like 10 bullets and that won't do anything.
I don't know where you're shooting, man. I smoke people with this all the time.
Yes, but it doesn't allow me to inflict the type of injury I want.
No other NPC here. I think. What's going on here? He's got a grenade. I don't like this.
What the hell?
Yeah, no, I'm
What
trying
the hell?
to get the pneumothorax and the tension pneumothorax to happen, so we're using those. The blood amount is, yes, it will be helpful.
Put that down.
That's what I was doing. I would watch for overpen though.
Oh shit! I'm hit. I've been shot.
Fucker just keeps on running. Alright, don't start heals yet. Heavy bleeding. Should be going out. Alright, never mind. He's still class 1.
Class 1 him.
You want me to shoot him with the 240? Let me see what happens.
Yeah, just let him keep going up a little bit. Once he gets once he gets class 3, we'll begin for him.
Does that mean chow
Alright,
hall?
class
I'm
3,
fucking
go
hungry.
ahead. Go ahead, start your medical procedures.
I'm bandaging his chest right now.
I've got his right knee. I think we lost
died.
him.
He
Yeah, he
died.
died.
We failed our test.
But he was a quick bleeder. So at that point, that means we would inject phenylephrine, slow down those bleeds as well, whilst
Okay.
you're getting bandagings on. 'Cause I know that he probably had multiple bleeds to his chest or abdomen, and then both legs and maybe arm or something. So phenylephrine would have definitely assisted there in slowing down those while you're getting those on.
So we probably should have. My bad.
As well as working on getting a saline on as well.
Okay. So we probably should have had one person bandaging, somebody do the what color is it? The green one, like you were saying.
Green,
I'm sorry,
yes.
I can't say the name. And then the person that does the green one put on the saline as well.
Yes.
Okay.
So, alright. We'll go on to the next. Let's see.
He's trying to run.
Alright, I'll work on bandages. Bandaging his arm right now, right arm.
I'm gonna start your guys' guy now.
Alright. Heart rate of 129, severe injury, class 1 hemorrhage. Impaired movement, impaired.
Alright, all bandages done.
Class 1 heavy bleeding.
I'm starting yours.
Different bandages.
I'll whip some epinephrine in there.
Alright. Check his blood pressure. Alright, go. You got blood pressure. Applying tourniquet. Slow down bleeding. You get C-lane ready?
What's his pulse?
You got a heart rate. He's got a
Come on,
heart
buddy,
rate.
you're gonna live.
Saline going on.
112, alright.
You're gonna live, buddy.
No,
Stay with me now.
I have an pneumonia. I don't want to spill myself though if you want.
He's gonna live. We got him, man. We saved him. Checking injuries.
Real
quick. You get class 1, impaired movements. Oh, he's good, bro. We got him. Okay. Oh, yeah.
Let's go.
That one was easy, though.
Oh, yeah, that was easy.
I'm bandaging him. Yeah,
So when you're doing compressions like that, keep an eye up on their heart rate.
Oh, he died? How'd he die?
Okay.
Our guy's up.
Keep an eye on their heart rate. Anything
Our guy
above
woke up, but he died right after.
115.
That's some bullshit.
I'd say anything I'd say around 125-ish, 130 will result in a stable heart rate, and then anything below.
I'm fixing his pair movement. I'm healing him.
80, 90 will also result in a stable heart rate. So I would keep that in mind. So once you see a heart rate above, you're good to stop compressions. Or once you see a good blood pressure that's above 40 over 22. Something that's, I'd say, jumps up and spikes up into the 100.
Okay. So 80 to 120 heart rate, good to go.
Yes. Wanted to get some class 3s and class 4s, so hold on.
Moderate injury. He's improving. You guys are writing notes? You guys got notes? Our guy woke back up and he was fine, and then all of a
There is
sudden
a text
died.
at the end of this, by the way.
I'm not sure what happened.
That is interesting, actually. I don't know why.
Yeah, he like crawled a couple feet and then just died. Margar is good right here.
Can somebody run that back for me one more time? Can I watch y'all do the whole process?
Yeah.
Hey, we put more. Hey.
He said, hey.
Alright, here, let me.
I'm hit.
Class 1 heavy bleeding. I'm gonna wait till he's class 2 or 3.
And you said you was gonna wait for him to be class 2 or 3. What is you waiting for?
I'm waiting for his situation to get worse, so he can show you, having to go through individual steps.
Oh, okay.
He's class 3 now. I'm injecting with phenylephrine to slow down his bleeds. He has a major bleed to his chest, so I'm about to bandage that first because you're unable to tourniquet. We'll be going straight to his leg next, I believe. Yep. This is going to be his leg. Motherfuckers. Man, these guys are bleeders. Fuckers.
I can
Usually
help
class
with
3
that for now.
Usually class 3 does not bleed out that fast. I don't know if it's just the AI models that bleed out faster than our characters.
I think that if they're an AI, they're gonna bleed.
You can do it on me. I offer my body for science.
Right out faster.
Try one of the not modded AI.
That one I just found, he's
make
gonna
it quick,
bleed
you
out
know what I mean?
50% slower.
Make it
You can
quick.
show me again.
Is that fucking ice around here?
I'm out of cigarettes
There's
anyway.
there's one right there against the light.
Yeah. Thank you.
Oh, I'm trying to
Fucking
get.
I
beat him
killed
to
him.
death.
You killed him.
Oh, no
Fucking
way.
beat him to death.
Hey, I'll be the dummy. I'll be the dummy. Smoke me.
Who said that? Crouch.
Behind you, behind you.
Class 1 moderate.
My back.
Wait for him to get class 2 or 3.
I shot him with a pistol, so he should be fine. Or a pistol round.
Shoot him again. He has to be unconscious.
He is unconscious.
He don't need sound effects.
He's not unconscious yet.
He's still talking.
He's class 1. If he's class 1, he's most definitely not unconscious.
And he's faster. Like, he's class 2 now.
Alright, he's heavy bleeding now. Once he hits class 3, I'm gonna start procedures.
I tried to hit him under the plate in the steps. I don't know if it actually did or not.
Yeah, it's hard to.
The color is fading from my eyes.
Alright. Yeah, he's going class 3 now. So I'm starting with Final Warfare to slow down his bleeds. I'm trying to find his heavy bleed, which seems like it's maybe just between 2 places. So it could be a buildup of bleeds from multiple places. So it might just be right, left arm. Looks like he has vomit in his throat, aka blood. To keep him from not breathing, I'm gonna have to clear the vomit. I will be checking his respiratory rate. He has 0 breaths per minute. I gotta start by intubating him. So intubation starts. As well as O2 levels are at 71%, so I will also put a mask on him.
Oh, so I did do the right thing yesterday. Question, do you have to remove the cap from that, or is it fine?
No, it's just automatically.
Okay.
So he is class 4. He is lost. That means 80% of his blood. So we want to get salines on him as fast as possible. So I'm gonna get a saline on him. Considering he's class 4, he will be in cardiac arrest. There's very few times that someone will be class 4 and not in cardiac. So we're gonna go ahead and get epinephrine started, and then we're gonna start CPR.
He's already class 3 improving, yeah. Working.
Yeah, so that means he's now up to 40% of his blood in his back. So after that minute and 30 is up for that saline, I'm gonna need somebody, or I can do it myself, to just slap another saline on him. So I'll tell you when that saline disappears.
I got one right.
So right now, like, his SpO2 levels are at 70%, which is not ideal. So that SpO2 is the amount of oxygen carried in the blood. So we want to see that get up a lot higher.
What's a good level for SpO2?
SpO2, I'd say anything above 85%.
He's class 2.
So we still don't have a heart rate. It's reading 108 artificial, and then I have a 15/10 blood pressure. So we still don't have a stable heart rate. So I'm just waiting right now to get that heart rate jump started again. Once I see a spike in his blood pressure, then I will stop my compressions. As of right now, he is still cardiac. If I stop, it's not going to do him well. So we're still waiting, checking to see if he's breathing. He is breathing now, so that's a good sign. He's got 14 breaths per minute. So yes, he is stabilizing. How long does what?
The fennel work for? Like, do you need to...
29 seconds. Phenylephrine only lasts 29 seconds along with epinephrine. So you only get 20...
So, would you want to hit him with another one since his blood pressure isn't good yet?
His blood pressure is stabilized now. He's at a heart rate of 131 with a BP of 121/81, which is right around resting BP. So that's a great blood pressure right there. So let's check his injuries. He's still class 2. So he will, after the saline's up, he will need a third one to get him back to class 1. So I'm going to start a third saline. We're going to start that now. That's going to bring him down to class 1. This is why I say everybody should keep 3 salines on them. Just for this reason.
Better now, boss.
I always do 3 salines.
And then at this time, like, you could go around, you could heal their injuries, so you could do the legs, arms, and then also what I recommend is while they're still in the down state, go ahead and search their body and take your equipment back. So their your King LT and your oxygen mask, or else then once they're up, they're gonna have to stop there, go into their inventory, look for it, drop it, and then you have to pick it up. It's just a lot easier to get it while they're still down. So he's class 1. He should be good now to just wake him up with some smelling salts. He'll be right up. Other than that, cool. It's unfortunate I wasn't able to replicate any of the pneumothorax or tension pneumothorax. I did earlier before training started, but I don't know why the AI didn't let me know. But so
maybe
if you
somebody
see,
should take their plate off and then you shoot them.
Yeah, we could. I don't know how much time we got left. I could do a quick check on the other guys real quick. Say again, Spooky. 5 minutes left. Alrighty. So let's see if I can. This might kill you in one shot. This might not. I don't know.
I'm hit! I'm hit!
So he's just got serious injury, heavy bleeding, no tension pneumothorax or pneumothorax. So that just means he didn't take enough damage to any damage to his lungs. That's gonna kill him.
My bad.
Alright, it was cool.
Lock them up, boys. Lock them up. Throw away the key.
I don't know if Ghoul's back over here.
Yeah, I'm here.
Okay. If you want to try that again, it's up to you.
Yeah, I got you.
Just make sure you don't fucking kill you while you're on the ground. I'll use my pistol instead.
Shoot.
How much more you got ready? How much more you got to go?
I mean, I really don't. Other than trying to get to replicate the new medical stuff happening, I don't really have much more.
Okay, they're calling for RTB to switch.
Alright, so it looks like it's time to switch. If y'all have any questions, real quick, go ahead and ask away, and then we'll be switching you guys out. And I think you guys are going to either.
Do they got grilled cheese here?
Say again.
Do they got grilled cheese here?
No, we got fucking beef stew. That's it.
Alright, so this is what's gonna happen. You guys stay in the Discords you're in. Shoots, you're gonna switch with Swizzy.
Okay. I mean, I'm gonna be honest. I haven't been using Discord this whole time. I've been using in-game, but.
I understand, but Swizzy has his guys in a different Discord, so that's
alrighty.
Determine what's going on.
Sounds good. Let me get.
Cheers, Shizzy, mate. Thank you.
Of course. I wish y'all luck in the next training.
Take it easy, Shoots.
Yo.
A lot of blood.
Wait, so where am I going?
Just chilling, bro. Blow your fingers for a little bit, you know?
So, just wait 1 second. We're getting stuff sorted.
Alright, what we're gonna do from here, everybody that's here, you need to respawn at the airfield. And shoot, Swizzy he said he had a little bit more time, maybe like another 5 minutes, so that's why we're doing this switch.
Yeah, I heard. So I'm gonna do some testing on some dummies. Yeah. Shit to replicate. May I get you to stop shooting, please? Are you a new recruit? I said, are you a new recruit?
He's the Russians for later on.
Oh, okay. So he's part of the PvP